As the world anxiously fights to flatten the Covid-19 curve, the country's border points now seem to be threatening the war against the deadly pandemic that has so far affected a total of 758 people. Health Chief Administrative Secretary Dr. Mercy Mwangangi says truck drivers are becoming a weak link in transmission of the virus in the country after 21 more Covid-19 cases were confirmed out of the 1,486 samples that are tested.
And all these 21 are Kenyans. The youngest is 7 years old, whereas the oldest is 79 years old. 14 are male and 7 are female. And 4 out of this number are truck drivers who are tested at the Namanga border. Out of the same samples, 8 individuals were truck drivers from Tanzania who also tested positive and were referred back to Tanzania. 7 at the Namanga border and 1 at Hispania border.
And in a bid to tame the surging numbers, the Ministry of Health has now called on Kenyans to be vigilant and report any suspicious individuals who may be using alternative routes to access the country.
As members of the East African community, we are in constant discussion with member states on how best this matter can be handled for the safety and well-being of our communities.
However, as much as the country has reported recoveries, the death toll has risen to 42 after 2 more people lost the battle to the deadly disease in Nairobi, with the ministry maintaining that community transmission also remains a major challenge in the fight against the disease.
In Mombasa, Likoni has 5 cases, Mvita 4 cases, Jomvu 2 cases, and Nyali 1 case. And in Kajiado, 3 are from the Namanga border point and 1 from Loitoktok. And in Nairobi, 4 of the cases are distributed between Isili and Kibra, with each having 2. While Uasin Gishu has 1 case from Tarbo.
And since the World Health Organization warned countries that COVID-19 will be with us for a long time, Kenyans have been called upon to adhere to the measures put in place in a bid to tame the scourge.
Yes, the virus is likely to be endemic going forward. As Madam CS has said, we'll have to adapt our lives with the virus in consideration. So we'll need to continue the simple measures that we have always discussed. And of course, the lifting of the restrictions that are in place will be gradual, based on science, based on information that we receive from our colleagues in modeling. Remember, countries that have gone ahead to be able to lift restrictions, and within 3-4 days, there's an upsurge in numbers, and then they have to claw back on the restrictions that they had placed earlier. It is best to be able to study this so that when you make a measure, you make it moving forward.
This, even as the Ministry of Health received an assortment of over 1,000 personal protective equipment donation to help protect frontline health workers. Gloria Milimu, K24, Evening Edition.